Strategy number 3. Choose the best study tools. With so many NCLEX review books on the market, it can be difficult to know which ones are best. Though many review books are organized by course areas common in nursing school, this format is not as helpful to those focused on immediate NCLEX prep. We suggest using an NCLEX review book that is organized according to the same client needs categories as the NCLEX test plan. If you are a repeat test taker, this will allow you to remediate based on the results of any NCLEX predictor tests you have taken, as well as the results of your candidate report. With these books, you can study the content areas you need to reinforce, rather than searching for the information you need. The categories of the NCLEX contain the same concepts learned in nursing school courses, but they are integrated into client need categories. For example, adult and pediatric medical surgical health problems are included together in physiological adaptation. Reduction of risk potential includes focused assessments or any intervention to prevent injury from an existing condition or treatment or procedure. Look up the official educator version of the NCLEX RN test plan and review the tasks in each subcategory. These form the basis of the questions written for the real NCLEX, and this will give you an idea of what you need to know for each section. Here are a couple of our favorite resources that go along with NCLEX Mastery. Number 1, Pearson Reviews and Rationales, Comprehensive Review for NCLEX RN by Marianne Hogan, MSN RN. This book really focuses on the need-to-know highlights in each client needs area of the exam. There is also a practice test for each section. Each rationale is thorough and includes a test-taking strategy. Number 2, NCLEX RN Content Review Guide, Preparation for the NCLEX RN Examination. This book by Kaplan Nursing is organized by the NCLEX client needs categories, but within each of those, there are smaller units that organizes the information in a helpful way for those still in school. This book is less narrative and a lot of bulleted material, but some may prefer this. It provides a review of essential NCLEX content and is updated annually. Another great book is Nursing Care Plans, Diagnoses, Interventions, and Outcomes by Judith L. Myers and Meg Golanik. When you're studying different disease processes and nursing diagnoses, this book will help you understand which interventions are the most appropriate and why. If understanding rationales or choosing nursing goals is challenging for you, try this book. Bonus tip: don't just collect NCLEX review books, read them. For this study plan to work, read every word of each section you are reviewing.